Hi everyone, this is Dr. Priyanka Mehta, obstetrician, gynecologist, women's health expert from Diva Women's Center, Chennai. We have been talking a lot about different topics related to women's health. So do continue to keep watching the videos and do subscribe to the channel for more information. Hi everyone, this is Dr. Priyanka Mehta. And in this video, we're going to be discussing about fibroid uterus. So women, when they do an ultrasound, sometimes a diagnosis of a fibroid uterus is given to them, and they kind of get confused as to what is the cause of this fibroid. Do I need treatment? Do I need surgery? Is there any medicine available? And so on. Now, if you understand, the uterus basically is made up of muscle, which is a smooth muscle, and sometimes there is either a growth or this muscle becomes little swollen, and that can form a fibroid uterus. Fibroids usually are not cancerous, so they don't form cancer, but depending on the size of the fibroid, depending on how many number of fibroids there are, and also depending on where is the location, they can cause different kind of problems, and then some of them may need treatment. So a fibroid basically is a tumor of the smooth muscle of the uterus, and it could either be a single fibroid or it could be multiple, that means more than one fibroids. The size of the fibroids varies from either what is called as a seedling fibroid, that is very tiny, to sometimes they become very big and bulky, almost growing up to 15 or 20 centimeters or even larger in size. Now, depending on where these fibroids are located, we actually classify them as we call them subserosal, where they are on the outer side of the uterus. We call them intramural, where they grow within the mass of the uterus and then they cause more symptoms, or submucosal, when they start growing in the inside part of the uterus. Now, because of these fibroids, women can either have absolutely no problem at all, so only incidentally when they have done an ultrasound, a fibroid is detected. Sometimes women can have either bleeding, which is very heavy bleeding, or we say very profuse bleeding, so they will pass a lot of clots and there is a lot of bleeding happening. Or the bleeding goes on to be very prolonged, that means they may bleed for 7 or 8 days or even more. Some women can have very severe pain during their period, which is called dysmenorrhea. Some women can also feel a sense of pressure or pelvic pain because of these fibroids, because basically what happens is the size of the uterus, which is normally around 7 or 6 centimeters, will just start increasing. Some women, on the other hand, can even have problems with either passing urine, where they can have frequent urine infections, or every time they pass urine it is difficult to pass because this particular fibroid or swelling of the uterus is blocking the way of the urine. Or some people can even have constipation, because as the size of the fibroid is increasing, it is going to press on the small bowel, the intestine, the rectum, which is close to the uterus. Now, what do we do for these fibroids? So, as I told you, sometimes women have these problems such as bleeding problem, pain, heaviness. Some women also have difficulty in conceiving, and when we do an ultrasound, we're able to understand. We basically advise to do a transvaginal scan or a TVS, and with that we're able to understand as to how big the fibroid is and where is the exact location or the position of the fibroid, and does it need any treatment. So if you have done an ultrasound and there is just an incidental finding of a fibroid which is less than 4 centimeters, it is not causing any symptoms at all, and you don't even know that there is something, you can actually just wait and watch and just keep yourself on a follow-up, maybe repeat your ultrasound after 6 months. Whereas if your fibroid is multiple, so more than one fibroid, it is more than 5 to 6 centimeters, and you also have the symptoms, then you may be probably needing the treatment. So treatment basically depends on not only what your age is, if the fibroids are big enough to cause fertility issues, you're having difficulty in getting pregnant, they may need treatment. or if they are causing very severe symptoms, they will need treatment, and also as to what your choice is. So the different ways by which we treat fibroid is, not all fibroids need surgery. So if the fibroid is very small, say less than 4 centimeters, we can just wait and watch. Sometimes certain medicines and certain injections are available, which are the hormonal tablets, or you have the injections which can prevent the size of the fibroid from increasing further. But these injections, which are the gonadotropin injections, we call them, sometimes they can not be used more than 3 to 6 months, and they will create a kind of a pseudo menopause that we say. So you will stop having the periods for those 3 to 6 months, and because of that you will not have any kind of a symptom. But after 6 months we cannot keep using this, because there is chance that you may develop what is called as a bone loss. So what do we do about the fibroids? Again, we will see what is your age, how big is the fibroid, what are the symptoms that are affecting you, and we don't have to always remove the uterus. So there are certain surgical options also. The one which is called as laparoscopic myomectomy is a method by which we insert a laparoscope and we just remove the fibroid or the myoma or that tumor alone, and then we suture back the area so that you don't have to remove the uterus. Hysterectomy is the option for fibroid, which is a permanent solution, and women who have maybe crossed the age of 40 or 45 and they have tried different medical methods, they have probably even tried myomectomy, but then again there is a recurrence of fibroid, or they have multiple fibroids and they don't want further fertility, they will probably sometimes take the option of the hysterectomy or removing the uterus. Certain non-surgical options are also available for fibroids. There are two ways. One is called the uterine artery embolization, in which the blood supply to the uterus that is blocked so that the growth of these fibroids is reduced, and then some of them can just lose their blood supply and then they degenerate and then they are passed out. But for more than 1 or 2 fibroids, multiple fibroids and different sizes, many times this uterine artery embolization may not work. And similarly, if you're planning for a baby or a pregnancy, sometimes after this there may be little delay in getting pregnant. There is another method called MRI FUS, in which ultrasound energy is used to dissolve the uterus, the myoma. But in this method also, the problem is that again, if it is multiple fibroids are there, then it may not be totally effective. So we have to assess the overall situation. What is it that is causing trouble? What is the location of the fibroid? How big it is? How many number of fibroids are there? What is your age? Because many of these fibroids will shrink or they will stop giving symptoms after menopause. So if you're approaching menopause and you have very mild symptoms, then we can even wait and watch. So do ensure that if you have the symptoms of heavy bleeding or bleeding which is very prolonged bleeding and it is not getting treated by the medical treatment, or there is some kind of a pelvic pain or pressure that you're feeling, it could be a symptom of fibroid. And the best way to find out what the problem is by doing an ultrasound. So we do the pelvic ultrasound or the transvaginal ultrasound so that we can understand what is the size of the uterus and what is the problem happening, and if there is a fibroid, depending on your choice, depending on the situation, we can offer you different kind of treatments. So thank you and take care.